chair now recognizes the gentleman from Texas, Mr. Crenshaw, for 5 minutes.
Thank you, Mr. Chair. I think every American should be concerned about the next pandemic because of how terribly our government handled the last one. Not only did the government lock down schools and businesses and mislead the public, but we were caught flat-footed at the outset of the pandemic. We were unable to identify the threat we were facing and where that threat was coming from. And that had pretty severe consequences for the way we responded to COVID. And I think this committee should aim to fix that. Moving forward, the American government must be able to quickly identify the source and severity of an emerging public health threat. That capability is required under law right now, yet we're still falling short of where we need to be. In fact, the Government Accountability Office found that, quote, more than 15 years after the law initially mandated it, the federal government does not yet have this needed situational awareness capability, end quote, to identify and respond to these threats. Moreover, the Government Accountability Office says we need a, quote, lead operational division to address this deficiency in our response capabilities. And I'll be filing this report for the record. So, to sum it up, there's no one in charge, and that's a problem. For Dr. Parker, I have this question. Should the Administration for Strategic Preparedness and Response create a strategy and implementation plan to aid our preparedness and attribute future threats?
Well, yes, we absolutely need a strategy for attribution, and we need, and attribution is important whether it's natural or unnatural. Kind of the attribution kind of gets more in the unnatural, and I think about national command authorities, so whether ASPR at the end of the day is in charge of the unnatural attribution, I'm not sure about that, but nonetheless, this committee could certainly require that HHS, DHS, DOD, DNI, DOE, who has actually some very good laboratory capabilities, develop a strategy for attribution.
And attribution and a kind of a single point of action and coordination as well. Would you agree with that?
I think that strategy would have to identify that. You should identify that they need to develop a strategy and develop then who will be in charge.
Right. And for that reason, I'm working on legislation called the Bio Early Warning Act with Representative Peters from California. And our bill is really simple. It does create an operational strategy and supports private sector technology that helps us identify every aspect of an emerging threat. Where is it coming from? How serious is it? What should our response be? And we do this by, one, making sure the Department of Health and Human Services and the intelligence community are actually working together and sharing information rather than working in silos. Two, creating a government strategy for attributing threats. And three, having the Administration for Strategic Preparedness and Response work with the private sector to create and deploy defenses that might be needed to respond to whatever threat we face. And this could be anything from advancements in genetic sequencing to diagnostic testing to wastewater surveillance. It should be clear because there's been some misinformation put out by one three-letter agency that this bill does not take away authority from the agencies that are currently doing this work. We just need a singular point of action and accountability to coordinate this work, and that's what the bill does. It's what GAO has called for. We can't afford to have the same information failures we had with COVID, so we have to work to identify and respond to the dangerous threat landscape that's always evolving. And another way to think of this is a joint operating environment in the military. It is confusing. You got Army, Navy, Marines, Air Force is there sometimes, not sure why, but but you always have a joint operating environment, and you have what's called combatant commands, who's in charge of everyone in that operating environment working together. And you absolutely need something along those lines when you're talking about a pandemic or a chemical attack or a biological attack. And of course, so I asked for my friend, Representative Richard, also known as the Admiral from Texas, also known as Dan Crenshaw's biggest fan, Hudson, asked for his commitment to work with me to ensure that this is addressed in this year's PAPA. And with that, I yield back.